Hard phlebotomy questions. Let's get started. What is the correct way to anchor a vein? Is it A, press down on the vein with the thumb of your free hand 1 to 2 inches below the site? Or B, stretch the skin taut below the puncture site? Could it be C, stretch the skin taut above the puncture site with your thumb? Or lastly D, let the skin bunch up? The correct answer is C. Here is why. Proper anchoring involves using the thumb to pull the skin taut below the puncture site. This stabilizes the vein and prevents it from rolling. A, pressing down below can collapse the vein you're trying to enter. C, pulling from above does not stabilize the vein below the needle. D, bunched skin makes the vein less stable and the puncture more difficult. Next question. Lipemia, milky serum, can interfere with tests by: is it A, causing hemolysis? Or B, causing erroneous results due to light scattering? Could it be C, clotting the sample? Or lastly D, binding all the calcium? The correct answer is B. Here is why. Lipemic samples contain high levels of triglycerides, which scatter light in photometric analyzers, leading to falsely elevated or decreased readings for many analytes. A, hemolysis is the rupture of red cells, unrelated to lipid content. C, lipids do not cause clotting. D, lipids do not bind calcium. Chelators like EDTA or citrate do. Next question. For which test is a timed specimen often required? Is it A, CBC? Or B, therapeutic drug monitoring, e.g., peak/trough levels? Could it be C, blood type? Or lastly D, cholesterol? The correct answer is B. Here is why. Drug levels must be drawn at specific times relative to drug administration, e.g., just before the next dose for a trough, or after administration for a peak, to guide dosing. A CBC can be drawn at any time. C, blood type is constant and not time-sensitive. D, cholesterol is typically a fasting, but not strictly timed test. Next question. The sharps container should be replaced when it is. Is it A, half full? Or B, 2/3 full? Could it be C, completely full? Or lastly D, at the end of the week? The correct answer is B. Here is why. Sharps containers must be replaced when they are 2/3 to 3/4 full to prevent overfilling, which can lead to needle sticks during disposal. A, replacing at half full is wasteful and inefficient. C, waiting until completely full is a safety hazard as needles can protrude or the container can be overpacked. D, a schedule is not as important as the fill level. It depends on usage. Next question. Which test is typically collected in a light green top plasma separator tube, PST? Is it A, stat chemistry tests? Or B, blood bank? Could it be C, coagulation? Or lastly D, hematology? The correct answer is A. Here is why. Light green top PSTs contain lithium heparin, anticoagulant, and a gel separator, allowing for rapid plasma separation. This is ideal for stat chemistry tests as it eliminates clotting time. B, blood bank uses EDTA tubes, lavender/pink. C, coagulation uses sodium citrate, light blue. D, hematology, CBC, uses EDTA tubes, lavender. Next question. A patient has edema, swelling, in both arms. The best course of action is to: is it A, draw from the antecubital area anyway? Or B, perform a capillary puncture from a finger? Could it be C, use a smaller needle in the hand? Or lastly D, ask the nurse to draw from a central line? The correct answer is B. Here is why. Edema dilutes the blood with tissue fluid, making venipuncture difficult and yielding potentially diluted, inaccurate samples. Capillary puncture from a finger, if not edematous, can provide a better quality specimen. A. Drawing from an edematous area is difficult, painful for the patient, and likely to yield a poor sample. C. Using a smaller needle in an edematous hand does not solve the dilution problem. D. This requires authorization and is not the phlebotomist's independent decision. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.